Okay. All right, everyone. I'm so sorry we were having technical difficulties. My name is Anna Rausch. I'm the Vice President of Program Operations for the Coalition for the Homeless. Matt, you want to introduce yourself?
Yeah, sure. I have a couple slides. I have a slide for that too, but Matt Simmons from Simtech Solutions. Nice to meet you all.
All righty. Okay. Sorry, messing with my controls. So the Coalition for the Homeless, for those of you that are familiar with the Continuum of Care system, we are the lead agency for the official name Texas 700 Continuum of Care, which is the geographic boundary area designated by the U.S. Department of Housing and Urban Development. So the Coalition as the lead, we lead in really a lot of development, advocacy, policies, and procedures. We coordinate the entire homeless response system and all of the strategic planning related to ending homelessness. And we also lead the HMIS system, which is the Homeless Management Information System. It's the database that's required by HUD for everyone to enter into client level information. We are quite large, but we'll get to that in a minute. Go ahead, Matt.
All right, Matt Simmons, President of Simtech Solutions. We've been focused on homeless data management since 2002 when we built the first HMIS. So HMIS is the Homeless Management Information Systems that communities need to use. So we built the first data warehouse to receive that information and conduct analysis off of that. And since then, we've kind of grown with the internet and started moving towards mobile-based technologies. And that's some of what we're going to be sharing today is how we're implementing the use of mobile-based technologies and reporting systems to support the work being done in communities like Houston.
So our continuum of care is about 3,700 square miles. As you can see, that's the entire, not just the gray area, but also the green. That's just one county. This is Harris County that you're seeing right here. What's missing is Montgomery County to the north and Fort Bend County to our west. So you can see there are a lot of cities that can fit into our Harris County area. The gray area is the Houston city limit, and then the green is what we call unincorporated Harris County. So there was an article in our Houston Chronicle a couple of years ago that said that if Harris County was incorporated as a city, it would be the 5th largest city in the United States. So we have quite a few square miles to cover. So we're very proud of our success in ending homelessness or decreasing homelessness in Houston. Prior to Hurricane Harvey, we'd actually had a steady decrease all the way from 2011. From 2011 to 2017, we had about almost a 60% decrease in homelessness. And then once Hurricane Harvey came to visit us, that changed just a little bit. What do you see, Matt?
I see a white screen right now.
Yep.
Make it one further, one more forward. There you go. In business.
So we're about to release our 2020 count. Obviously, we were going to do that right before COVID hit, so things got delayed a little bit. But in 2019, our homeless count was 3,900. When Hurricane Harvey made landfall, as I mentioned, we decreased homelessness by almost 60%. And then from 2017 to 2018, we did see a slight increase. So it was about a 13% increase. And when we pulled the unsheltered report, we actually had the question in our unsheltered survey tool, and 18% of the individuals indicated that they had become homeless due to Hurricane Harvey. So fortunately, we saw a decrease again of 5% from 2018 to 2019. Not sure what this year is going to bring, but if I had to make a guess, I would say it's probably going to stay around the same. This is Hurricane Harvey from the Hurricane Center. This is how big he was when he sat over our territory. This is gonna get, finding. I think my internet connection is. All right, so this is one of our major streets here in Houston. On the left, you can see is what it looked like before the hurricane, and then during and after people trying to evacuate on that street. You can see the trucks are covered as tall as they are. They still had water all the way up to the doors. This is the main highway, or the main interstate going into town. I might just do this because it seems like it's losing.
Yeah, whatever works. I think people could see it from there.
Yeah. This is I-10 and 45, what we call the Interstate 10 and 45 interchange in Houston. It's one of our major highways going into downtown area. And you can see that the water got all the way to the bottom of I-10, which is pretty high. And that entire bayou over to the left was completely full all the way to the top. So some Harvey effects, we had 19 trillion gallons of rainwater fall on parts of Texas. I mean, it's a lot. They said it was something like, somewhere I read that you could see, you could put 2 inches of water in all of the United States with the amount of water that hit Houston and the outlying areas. So 80,000 homes had at least 18 inches of water. There was so much rainwater. And the houses were filled, some of them all the way to their rooftops. 780,000 Texans had to be evacuated. We had to evacuate 122,000 people or rescue from high water with their pets. And then the Houston Housing Authority estimated about 1,000 affordable housing units were destroyed. And that's just the Houston Housing Authority. That doesn't include the thousands of units that were damaged where we had people in housing. Formerly homeless individuals that had we placed in housing. So with some of the disaster response coordination that happened on site was obviously local government. So we had some city, county folks in our 2 largest shelters, and then the state did send some representatives. We had federal government from FEMA and HUD. We got HUD TA assistant pretty much immediately due to the fact that they realized that so many people was going to become homeless and really was impacting our homeless population. Our local Continuum of Care, so all of our service responders, as well as the Continuum of Care League, which is the Coalition for the Homeless, we all had to be on hand to coordinate this massive response that was happening. And then of course, the nonprofits, American Red Cross and local agencies, we all had to come together to figure out how we were going to help all of these thousands, hundreds of thousands of people to recover from this catastrophic storm. This is what George R. Brown looked like. So George R. Brown is a huge convention center in Houston, in downtown Houston. And this is what it looked like during the days when everyone had evacuated. We had the George R. Brown Convention Center as well as NRG. So because this event was so unprecedented, usually I learned a lot about the Red Cross and their response. Typically the Red Cross will show up and set up a shelter residence. So they actually have a lease with the Red Cross of wherever that shelter is located. But because there was such high water, the Red Cross actually couldn't make it to the George R. Brown or NRG initially. So that's why our response was a little bit different than most cities. The City of Houston Housing and Community Development Department and their health department actually got to the convention center way before the Red Cross did. And so that's what started this massive shelter operation. The NRG, again, because the Red Cross hadn't gotten to that location, one of our local partners, Baker Ripley, which is a large anti-poverty partner, they had to set up residents along with Harris County Community Services for the 2,000 plus evacuees initially at NRG. George R. Brown, which is the picture you see here, had 10,000 evacuees initially. The Continuum of Care received the disaster TA, and so we had to be on site to coordinate the response. Obviously, it starts with a whiteboard before we start doing our fancy work. But by the time the homeless response system got involved, the week of August 31st, the shelter count was down from 10,000 to 2,400. Not manageable by any means, but a lot less scarier than 10,000 people. We had to develop an exit strategy. So that was actually the mayor's edict out to us is you have to develop an extra strategy for all of the residents at the George R. Brown, as well as NRG Stadium. And so we had two main objectives. We had to know who was in the shelter, and that sounds a lot easier than just what it's written, but it's not. And then we had to know what resources they have to leave the shelter house. By who is in the shelter, it actually means what type is this person homeless? Is this person couch surfing? Was this person in a lease for his or her own name and could possibly get some FEMA assistance? So these are all of the questions and the things that we had to consider as we were developing this initial strategy. So let's see if it'll go. Working so well. This is a better revised version of that strategy. This disaster triage assessment we'll talk a little bit more about. It involved the mobile app that Matt is going to describe, but it was really, we wouldn't have been able to do it without that mobile technology because there were so many people in that shelter and our current HMIS system just wasn't going to work. So is this me or you, Matt?
Let's go ahead for you.
Okay. So these are all of the reasons why we decided that a mobile app was the best option, the best way to go. Matt and I had actually had a conversation about his mobile tech in the week before Harvey, before we knew anything was going to happen. And he kindly reached out to us to, offer their assistance. And so after we discussed amongst ourselves and tried to figure out, we knew we weren't going to be able to just go person by person to try to figure out who was there. It would be faster if we could repurpose the tool and ask those questions. So really, it's very quick deployment. We didn't have to worry about training users and assigning user ID and passwords, which is what our HMIS team would have had to do. The app can be downloaded pretty fast to mobile phones and to iPads. We didn't have a lot of computers at George R. Brown, so it would have been really better to use a computer if we'd had to use HMIS. It's not easy to use it on your phone. Very easy to try to set up and train there, as opposed to HMIS. Sometimes people have to get trained several times before they can really get it. And then of course, Matt and his team at Syntech were available for tech support as we were rolling this out. I think this is you.
Yeah, this is me. All right, thank you for all that background. So yeah, the week before Harvey hit, we were talking about using our mobile app called Counting Us for the annual HUD PointInTime. So it's another acronym called, they call it the PIT count. So that count happens at the end of January. So we were talking in August about work that was going to happen in January. It's a national count activity, and it's the census. The intent of it is to capture details about people experiencing homelessness, both in shelters as well as those living on the streets. So that was the game plan for that. And the surveys that we have in our app at the time were really oriented towards this HUD point-in-time homeless count. So what we needed to do pretty quickly is, if we're going to leverage this tech for a Hurricane Harvey response, is how can we use what we have? What do we need to modify? And then let's get it implemented and out. This was not a time where we could say, let's make this the perfect offering. We just didn't have a window of opportunity for that. So without letting perfect be the enemy of good, we went with which I think was pretty good. And it was a matter of a couple of days when we had the initial setup within, I believe, a day. But then to get everyone trained and onboarded, it might take a couple of days. I forget what the final turnaround time was, but it was pretty quick, which wouldn't have happened with the typical desktop-based solution that would have needed internet connectivity and training and what have you, and user accounts for everyone. People can self-register an account. And one of the other benefits of this, it wasn't really called out, is it's the way that these survey tools work that are different from a case management software is it's one direction. So information gets posted to a server, but you're not pulling information back from your phone, from the server back to your phone. So that enables us to extend this and have a little bit lighter security controls, given that people can't fish for information, we can only submit information. Some of the examples on the screen are, there are some communities that are using this to manage what's called a by name list. So to know who is homeless in the community at any given time. And then we have, again, the point in time counts. And so last year for the 2020 count, we had 43 communities use the tech. It was an off year. It's only required activity every other year. But Houston was one of those communities that decided to go forward with this, an annual activity as well. And, I think in San Diego, which I'll touch on, was also a new client for this, and it's more related to COVID. I'll touch on that in a bit. So I think I'm good on this screen. So there's two parts to the process. There's the data collection app, which is, sometimes it's volunteers. In this case, it's people working at the George R. Brown, working at the convention centers. The information gets gathered from the app and it gets posted to a command center. And the command center, the intent of this is to have an ongoing list of people that you're working with. And for this, we needed to use that list as something to work down. You have to build it up. Here's all the people that are here at the convention center, and then ideally you start moving them over into housing opportunities one at a time. Sometimes it's a little bit faster. So there's filters that are baked into the command center that allow you to set, depending on the housing opportunity, maybe maybe there's some criteria related to eligibility for FEMA. And when you're talking about FEMA eligibility, I think some of the key criteria were, was this person, did they have a lease at the time when they became homeless, from the disaster, or were they a mortgage owner? Did they have a mortgage? And, that helps influence it. And the other piece that we needed to know is whether or not they were already homeless before the disaster hit. So one of the things we were able to do is match up the data from what was gathered from the app against what was collected in the homeless management information systems, the HMIS, to find out if, there's some people, which of the population were indeed homeless before the hurricane even ever hit. So that's this piece. And this is back to you. This is the more involved workflow. You're on mute.
Sorry.
There you go.
So as I mentioned, when we were doing this piece, we really needed to figure out who was in the shelter and what category they were going to fall under. And that's where, the mobile app was so valuable. Once we figured out who those individuals actually were in the sense of what type of service they were going to need, then we quickly rolled out this disaster recovery workflow. So each of these color boxes is a piece of, something that someone was doing. So the gray was us there at the navigation, or we call the disaster recovery shelter. And really most of this happened there, except for obviously the landlord negotiation and the transportation. And this is what happened for every single person that was housed through what ended up being called Housing for Harvey. And all of these individuals that eventually were identified and housed through this initiative were then entered into our homeless management information screen system. It helped to do the matching like Matt mentioned earlier, because we knew that if they, depending on what service they had been receiving in HMIS, would confirm to us that that individual had in fact been homeless and maybe was already in our housing waiting list or the pipeline for housing. And then the end results is that we housed 801 individuals, 600 households in 56 days, which was really unprecedented, but it just goes to show that with the right number of resources, not just financially, but in people resources, it can be done. So 257 of those were housed in an old Star of Hope shelter facility. We call that Residences on Emancipation. And then 334 households were in scattered site apartments. So that was 149 children, 25 multifamily properties that were, recruited via landlords for this entire process. Some lessons learned: FEMA and Red Cross did not cover the cost for the tech. We really, as a result of what happened with Harvey, it really demonstrated that we weren't prepared for a disaster of this magnitude. And so a lot of disaster policies and procedures were written. A lot of organizations created staff devoted specifically to that. We did have an entire after Harvey action plan that was put out. with some recommendations on moving forward. People with mental health problems, there was a lot of issues with those individuals not being able to access their medications in the shelter. So it became quite problematic not being able to get them their meds. Senior citizens obviously have a lot of different care needs. Those with severe mental health and physical health conditions, it was challenging as well, because you saw how the shelter was set up with cots everywhere. And so those individuals had to be put in a special section. And when time came for transportation, and even on finding units, we had to make sure that they were going to be able to properly care for themselves. It was very hard in the beginning to match the need for help with the resources that we had. And then really, FEMA, Red Cross, and the shelters, they all need to be connected. I mean, ASAP, pretty much immediately, in order for the communication gap not to widen. But obviously, with the way that Harvey happened so fast, and there was so much catastrophic flooding that people couldn't get around in the city to get to those places. So that's not sure if that's something we can ever address. Turning it back over to you.
Sure. So I put the question mark after lessons learned from Harvey, just because we're now dealing with a different type of disaster, a pandemic. And there are some items that were on that list that I think if you look at that, you can say, if I thought about, lessons learned from COVID-19, some of these things might still resonate. And, it's something to call out and to advocate for, that it's not just a Houston issue, it's a national issue, and it's a community issue everywhere. But, we'll tease out some of this, but, we were caught unprepared a bit for Houston and for the hurricane. And I think the same holds true now for COVID. So hopefully we can see a theme, and then we can start working towards addressing those themes. So the next time, something like this inevitably happens, whether it's the wildfires in California that happened, which had similar issues, heaven forbid there's another type of hurricane like this, but, unfortunately, I think that's going to be the case. What can we learn from this, and, treat it as a learning experience. So with that, let's talk about COVID and where we are now. So fast forward 3 years. These are stats from, just from California, and we can have national stats as well. I'm just going to focus some of the time and energy on California specific conversations, because that's where I am now, and we're supporting the work here in San Diego. So you have 81,000 plus cases, confirmed cases, and unfortunately, just over 3,300 deaths so far that are confirmed and related to COVID. On that, some of the what we're seeing for stats, you don't always get when you have a confirmed death what the actual case is. So we could think that's a little higher. And we're seeing that the spikes in the homeless population as far as an increased mortality rate. And while they're not all attributed to COVID directly, it doesn't say that. We don't necessarily have all the data tracking for that. The uptick is makes you question what else is happening. And so I think whether it be a direct relate of being infected from COVID, or the stress and anxiety and the lack of social supports as a byproduct of COVID, that's something else to tease out. So in this case, this is a picture from the Tenderloin. They're having a 285% increase in tents in the community. So some of the, that's just one thing. It's more public facing and visible. If you do live in a community and especially urban areas, and you do take a drive downtown, I think you'll get a sense of those people that are living on the streets and how they're being impacted. A couple of the challenges that people that are already experiencing homelessness are facing is, first off, they're already highly vulnerable. They're more prone to disease and infection. Sometimes the sanitation issues that contribute to that. But it's also highly stressful being homeless and having to fight for your next meal. The dietary intake for people experiencing homelessness is based on what's available, not necessarily choice. Going to Trader Joe's and picking up a bag of salad is not something that's it would be a luxury for a lot of people. there are also now less shelter beds due to new guidance from the CDC to create social distancing. So, you know, a 100-bed shelter might now have 50 beds. And so what that means is those beds are gone from the community unless they're stood up elsewhere. And so, you know, that's something else to factor in. You know, there is an inability to social distance when you are going to a shelter. So that also, you know, and with everything we're hearing, that's also causes stress and anxiety just with that. It also puts you more prone to risk of a COVID infection. The hygiene facilities don't exist to the extent that they did before COVID. You know, there's a lot of people that rely on the park system, for example, or the libraries, as well as restaurant bathrooms. So things that you might, you know, if you think about, like, if I had to live on the street, where would I go and what would I use? A lot of those facilities are closed down. A lot of people would use gym facilities. So they sign up for a inexpensive gym membership and take full advantage of the showers there. It's also not just hygiene facilities, it's a place to go to the bathroom. So it's both staying clean and having a place to go to the bathroom. And when you don't have a place to go to the bathroom, if you're living in human excrement, that puts you at higher risk too. Not only just for COVID, but for hep. Hepatitis is it tends to be born from that. And it's just a disgusting, filthy way to have to live, unfortunately. So, that shutdown of the supporting structure had a huge ripple effect. And so beyond that, because we had a shakeup in our social network, people don't often know where to turn for help. And we're not seeing the influx yet from the economic reaction to COVID of having, the floodgates open, partially because this has been some federal stimulus to offset that. But we can expect there's going to be a long-term effect with it. There's going to be more people coming in, and they're going to need to know where to go to. But when you disrupt what was their norm, I used to go to this food program, I used to go to this shelter, and you shake that up, and keep in mind those shelters and those nonprofits, we're having staffing issues. Keep in mind, use an example of a single mom who during the day, works at a nonprofit and commits her time there, and that's her job. But now the childcare that used to be the school is gone. That puts the person at risk. You also have people that have people that are vulnerable they live with. So you have whether they're seniors or chronic health conditions, and they can't afford to go in and work with a high-risk community all day long and then come back and put their family member at risk. So what we're seeing is we're seeing shorter, we're seeing less people to work with, to help support the homeless community. And so that's actually causing, in some areas, a contraction of resources just to try to make ends meet with what they have. I'm good on that. So in this case, this is regardless of COVID, this is basically neighborhoods where Americans face housing stress. So any of the darker areas on the map are households spending more than 50% of their income on housing. So you'll see a percentage, so more than half their income going into housing. So the everything that's light is 0 to 20%. But the darker areas, they tend to be in the West Coast. So you'll see a fair amount of that in California, Oregon, and Washington. And that's where we are. So on the California, it's roughly 1/9 of the population of the country, but roughly 1/4 of homeless people are from California. So it's an overrepresentation there. And then within the state, 71% of that population, of the homeless population, are sleeping rough, which so basically sleeping on the street. So back to how Ann and I started talking, we also do this HUD point-in-time annual homeless count. This is what happens with the data is we take this information, we submit it to the U.S. Department of Housing and Urban Development, and we're quantifying the extent of homelessness around the country. In this case, each of these bands represent a region around the country, and you'll see, I highlighted San Diego, but some of the wider regions are LA and New York. LA more particularly for individuals, and New York more for families. So we use mobile tech for the point-in-time count. As HMIS administrators, we've been doing this for a while. that the litany of reasons of why we do it are there. But in short, with paper, we had to just gather all the paper, rekey it into some kind of Excel spreadsheet and make sense of it all. And it was an error-prone, pain in the neck process, and it just took way too much time. It was a time suck, and people wanted to know constantly, what are the results of the count. And if you're supporting more than one region, it gets tricky. So we automated and we built what I believe is the first mobile app geared specifically for the point-in-time count, and have added to it since. But the virtues of it are that it's real-time data collection. That's probably the biggest one. The other one that comes in is GPS enabled. So every phone, every smartphone at least, when you're capturing a survey, you can actually identify the location of where that survey took place. And then beyond that, we have the metadata, so information about the survey. So we have information about the surveyor, and the location and the time. And so, beyond, what we're capturing about the person, we have details of what's happening. And so that actually is helping to inform some of the COVID response, which I'll talk about, and moving on. So in this case, San Diego, we did the 2020 point-in-time count. The 2019 count was a paper-based count, but 2020 we went digital, and it was just in time for COVID. So that we did see a drop in homelessness countywide, and that was largely due to a shift towards more shelter beds, standing up more shelter beds. So it's actually a win on that side, that we had not only a drop in the count, but we saw the street population decline while the shelter population increased. So, this is a quote from Councilman Chris Ward. Basically, what we're saying is during the COVID-19 pandemic, these best practices, basically the use of this mobile tech and new technology, have delivered more accurate actual data to public health officials and have allowed outreach workers to specifically target at-risk homeless individuals for life-saving services. So what they're saying, so in this case, I'm showing a heat map. What we're able to do I'm obfuscating, I'm hiding the pinpoints on the map with this, but we're able to look at the map and see where our concentrations are of people experiencing homelessness. So that's going to help the county make decisions about where to place and direct services. And there's an example of that on the next page, I believe, next slide. So in this case, right off the bat, they deployed 66 hand washing stations. But then this has been bumped up to 300. They're using data from the point-in-time to direct that information. So, these hand washing stations help people take care of themselves and provide some basic hygiene.
I also wanted to add that we use the point-in-time data, not just the map that's enabled from the mobile command center for the Counting Us app, but also we took the raw data and used Tableau to make a map, which we shared with our outreach teams, and we were able to make decisions as well on where to place the hand washing stations during for COVID, as well as to determine where feeding needed to be provided or outreach services. We designated certain areas for certain outreach teams, so you can use that as well. But it's definitely a very useful and valuable tool.
Okay, so on the note of using GIS data and geospatial reporting to aid in the response. So yeah, we're capturing date, time, and location. If we want to do a patient zero type report, a contact tracing, going forward, we could look to conceptually do that. There are some questions that would have to be nailed down, and I think part of that is how much time in contact with someone, at what radius, does it count to have an interaction from someone that is patient zero with the next subsequent person, and so on. To be able to follow up and monitor people, it's important to know where people are and how they're doing. So this idea of a health and wellness assessment, they can be conducted over time. You might be feeling great on Tuesday, but might be feeling sick on Friday. We need to know where people are and how they're doing. And then if someone isn't doing well, we need to be able to quarantine them and treat them as needed. So in order to separate them from others, take care of them, but make sure that they were kind of, putting a dead end on that infection, at least from that person, and make it so they can't infect others. And then where possible, in order to reduce mobility throughout the community, to support shelter-in-place models. So a shelter-in-place model, according to CDC guidance, which we'll share in a second, it basically says that we need to try to give people what they need so they can stay put. So if they don't need to wander through the community to find a meal or a place to go to the bathroom, there's a less chance they're going to have contact with other people. So again, it goes back to the idea of social distancing and supporting that with a shelter-in-place model. The triage process itself, I have a slide too to follow that's from Houston that you shared, Anna. In general, ideally we're going to stand up in different communities different housing options, and this might be new hotels that are sitting vacant because basically there's a shutdown and tourists aren't flying around, and business is not usual, so we have a lot of vacant hotels. There are standing up other temporary type shelters, whether they be tents. Some communities are having sanctioned encampments. You'll see, I saw, to the point where it's also sometimes it's a parking lot with painted lines. You see that in Vegas. Whatever it might be, ideally, you're trying to provide support and putting people in the right place and guiding them towards that place. And so this decision tree, if you will, helps navigate whether someone's COVID positive or a person under investigation, that's PUI. The other side of it is, they might not be positive at all, but if they were to be infected, their risk of dying is greater. So, following CDC guidance to screen out people with chronic health conditions or senior citizens and separating them from the others and kind of taking care of them a little bit, more. There's a case for that.
This is the triage process for Houston. This is the workflow that we had to create so that our outreach teams in shelters and hospitals knew how to respond to individuals that are experiencing homelessness and either need testing or have symptoms, or they've been tested and can't return to the emergency shelter and can't be left outside to recover from such a devastating illness. So, right now, hospitals that have an individual that may have tested positive have to contact the quarantine isolation facility. And this facility was a hotel that was set up with county and city dollars. And then they also email us, so myself, and I have to verify in our HMIS system if that individual is in the system or not, in order for them to make arrangements to transport that individual to the quarantine isolation facility where they will recover, and then at the point of discharge, we'll make arrangements for some type of housing intervention. Regarding outreach shelters and then any others that may be on the streets, we were actually able to get infrared thermometers distributed out to all of our outreach teams as well as our shelter partners so that they can monitor temperature as well as some of the symptoms that were shared with the CDC. And then our local healthcare for the homeless actually took over this process, the testing process for us. We have health departments for both the Harris County as well as the city of Houston, and they don't necessarily talk to each other. So it was very difficult for everyone to come to a consensus. And so our healthcare for the homeless, working in partnership with other healthcare for the homeless across the nation, was able to come up with a testing procedure for our clients. And so someone built out a website for them, and by the time they came to us, all of this had been done. So then they're the ones that conduct the testing at their location, but they will pick up the individual via a contract with Yellow Cab through the city of Houston. As long as they reside in Harris County, they can be picked up anywhere, taken to Healthcare for the Homeless where they're tested, and then from Healthcare for the Homeless, they're taken to the quarantine isolation facility to either wait on their test results or recover if they've tested positive.
So on that, related to that, this is a basic health and wellness screening. And this does change. We put this up pretty quickly, and we were using CDC guidance. There was other health assessments and screening assessments out there. Now we're hearing more about asymptomatic cases, so people that never showed flu-like symptoms. Originally the guidance was we're going to, if you have a fever and a cough, we're going to, look to put you in a hotel or other space. So part of the screening really does matter, depend on whether or not, for example, you have temporal thermometers. Even originally that was thought some didn't have those. But now it also comes down to testing too. So you might, whether or not you actually include, if you have testing, then your questions might lean one way. But if you don't have testing facilities, you might have to dance around that basically and look towards symptoms. So there's both more of a quick survey, which really goes back to those key symptoms in a temperature of 100.4 over. And then there's a more in-depth survey that kind of leans in towards, some of the things that are related that might help address, housing barriers. So does the person have pets? Do they have a partner? Are there certain possessions that they might need to bring with them? So it's a little bit more involved, and the more in-depth one. And then the shorter version is really, if you don't have the time to serve everyone, but you need, in-depth, but you need some key information to figure out the triage process. And both of these surveys are available. We added to the Counting S app to make available to these communities. Back to this is using existing data from the PointInTime. We can also do it in the homeless management information systems. We can look at the existing client base of people that are homeless and identify those people that are vulnerable first. And if we do have housing, ideally, prioritize them over people that maybe don't have a chronic health condition or are younger, that would have a better success rate if they were to be infected. So again, this is the mobile app version of this. We basically put this out there and say, if you even want to kick the tires, go ahead. There's a setup key that people would have to enter once they download the Counting S app. In this case, it's Stay Healthy. And they can, the idea was that we're not building this saying this is everything and we have it all figured out. It's to be able to pilot it, have communities react and give us feedback so we can adjust. The CDC guidance on the campus, which I did touch on, it does go back to this idea. You need separation and distance, ideally between your tents if you have them. But there are some communities that are still sweeping encampments, and the CDC says that stop doing that. It's not a good practice. We need people to stay in place. And ideally, if they have 10 or more people, you're actually going in and providing hand washing stations, providing a place to go to the bathroom with a portable toilet, and giving them supports they need. And so some communities are going as far as bringing meals and water to people, beyond having hand washing stations, having the portable toilets. And what used to be that encampment over there that they're going to do their thing, and we'll clean up the trash afterwards and deal with it. They're actually being proactive and putting supports in place and treating it more of a sanctioned encampment that has community support tied into it. So with that, in order to have something like that, if you had a screening tool of the encampment, there's some key information you might want to know about that encampment, to say, do they have what they need to shelter in place? So again, we have a basic survey that outreach teams can use to take it, gather information about a general encampment, not only the location of it, but some attributes about it. And, if there does need to be follow-up, we can at least capture that need and then circle back and address whatever gaps there might be that are preventing a true shelter-in-place model from happening. In this case, the San Diego County, like Houston, is rather large, so you can't just say, okay, nonprofit X, you're going to go cover, go do outreach. You need to kind of break it up into manageable parts. This map, I think it's from presentation view, it'll be interactive, but the point of it is that the county administrators and other people can set up their count teams and designate areas to those count teams. So that way, everyone has a piece of the puzzle ideally, and there's no pieces of that puzzle that are missing. And when you go through this exercise, which a lot of communities haven't done, you'll also sometimes realize that there's overlap in areas. So, you know, when there are those times where there's overlap, you know, sometimes it makes sense to say, you know what, you know, instead of covering this area, would you mind covering over here? You know, and sometimes it's tied to funding and some conversations have to happen, but, you know, it's important to know what you have to work with and make sure there's no gaps, you know, when you think about the whole county. And this, you know, by mapping it, we can do that. We did do some custom refinements to the app and to the command center, just like we did for Harvey. In this case, custom filters. And I'm just going to breeze through these just for the sake of time. And also the next one is custom tagging of the surveys. So we can designate different attributes, whether if you want to have the person shelter in place, if they're on a wait list, if they're highly vulnerable, et cetera. You know, testing results. And that allows an administrator to quickly filter the list. And you know, if they have a resource available for a certain population, they can work off of a subset of the list versus working off the whole big list. And now we're at the point of trying to support meals and water distribution. So the logistics behind this, again, going back to the shelter in place model, is we need to know where people are, who's been given what, and from the supply side of it, to know where the distribution points are going to be. So ideally, you're dropping off, you know, maybe you have a central location or, you know, a general kitchen, if you will, that's making hundreds of meals a day. Well, they leave that kitchen and they have to be dispersed throughout the community. Where do they get dispersed? How many get dropped off at each location? And some of them might be actual soup kitchen styles. Maybe they're set up in a tent for now, where you have volunteers that can serve food. And other times, they're outreach teams that have training. They're going to bring the foods to people, and you know, and it starts off, you know, ideally with food and water, but ultimately you start moving more towards full-blown case management activities, things that might not surface, you know, might not everyone might be aware of, but things like clean socks are really important for people living on the streets, hygiene facilities. Hygiene supplies, feminine hygiene products, sunscreen, so cell phone chargers. There are ways, you know, and then they have solar powered ones too. You know, a lot of people, you know, do have cell phones, whether or not they're homeless. It's one of the last things people give up. So if we can give them what they need so they can stay, then you know, it reduces that mobility that we're concerned about. You know, because that reduces social distancing. So in order to do that, you know, we can take the pinpoints on the map gathered from the app, and you can start seeing trends on the maps and say, okay, there's a concentration over here. And you can quantify how many people are in that, you know, 2-block radius. And again, that's if you're thinking about how many meals you need to cover this area. You know, you don't want to come into an area with 100 people with only 20 meals. That's not going to be a good situation for anyone. So to be able to look at a map and say, all right, if we bring it, we're just going to cover this area, go to this park or this area, how many meals do we need? And one of the things just to point out that they're doing is it's not just one meal at a time. It's 2 meals typically at a time. So it's a meal for now and a meal for later. Just knowing that the points of contact are limited and the outreach staffing is limited as well. So just something interesting that came up with that. So that's that piece. And then where we're going to you know, with all of this is there is a silver lining, you know, and there's a silver lining with COVID in the sense of help the you know, the environment. You know, there are some silver linings sometimes in life. In this case, it is putting a little more time and attention on the homeless problem. And you know, for us, we're using the work that we're doing now to support communities using the current technology to inform our future technology. And so some of the things outlined here with a separate app that would be bi-directional, meaning someone logs in, a trusted outreach worker could log in and they could see information that's already been gathered about a person, but really more quantifying needs and not just you know, collecting demographics, but quantifying needs and then identifying unmet needs, and then working with a dispatch or a command center and kind of shifting the model, saying not everyone's going out in the street today. We're going to have a couple people stay back, and you're going to provide oversight of what's happening around the area. And if we need more compression socks, you know, because we have a fair amount of diabetics, your job is to help order, you know, let us know when we're running low and order them. And if we need community lockers to store supplies, say we have, some of those basic needs, to start figuring out what those lockers have for inventory. And so that way outreach teams don't have to always go back to central command in order to restock. And so there's other opportunities here to support people living on the street and engage people and then get them off the street. And so, you build that trust over time with these relationships, and you don't come out asking for everyone's life story. You ask them, how can I help you? And, how are you doing today? And treating people like the humans that they are. And, once you build up that relationship, then you can start breaking down those barriers, building up trust, and then start nudging them towards some of the services and supports they might need. But big thing is like getting, what's it going to take to get someone into housing to stay there? And the other side of it that I think that this is kind of, open up eyes, we're all telecommuting right now. Well, the same thing can be done for telemedicine. So not all medicine and all care has to be provided face to face. And so to be supporting virtual case management and telemedicine through mobile-based technologies, I think is going to help a lot more people, because you can work with the existing staffing you have to support more people. And a quick check-in sometimes all you need. How are you doing today? You don't need a 30-minute, meeting at a certain location to figure that out. And if someone's doing fine, you can move on to the next person. So that's where we're going with this. And our contact information and details for both Anna's organization as well as the product. My organization is Fintech Solutions, but I focus on the technology itself is PointInTime.info. Are there. Our emails are there. I think we can open up to questions. We have a small group here, and again, apologies to everyone for our inability to log in on time. But yeah, if if anyone does have any questions, either use the chat or I don't know if we can unmute people, Anna.
Let me see. No. Let's see. Oh yeah, I can. Hold on. Unmute all.
All right.
Any questions? Okay.
All right. Well, we'll be monitoring the Slack channel as well. Again, you have our information, and again, our apologies for dying in late for the technical snafu. But yes, if you feel free to reach out directly. And thank you for your time, and hope you enjoy the rest of the conference.
Bye, everyone. Bye, Matt. Good to see you.
All right. Bye, Anne. Good to see you again.
Take care.
All right. Okay.